Good afternoon, family and friends across New York State. I'm Paige Pierce, CEO of Families Together in New York State, and we're thrilled to be hosting another town hall. Today's town hall is on developmental disabilities. And as we've done in the past with our Family Empowerment Month this year, we have invited key legislators who are the chairs of specific committees and the commissioners from the state agencies related to those committees or related to that issue. Today's issue of developmental disabilities, we're excited to have Assemblyman Tom Abinanti, who is the chair in the Assembly for the Developmental Disabilities Committee. And we'll have Senator Mannion joining us shortly. He had another conflict that he's going to join us hopefully midway through our town hall. And we're thrilled to have with us today the new commissioner at OPWDD, Carrie Neisfeld. We've worked with Kerri for many years when she was on the second floor, and we know that we're getting an ally and a friend in her as our new commissioner at OPWDD. So I'd like to just take a second to introduce the two of them so that they can say a few words, and then we're going to turn it over to Kim Kaiser, who is the moderator for today's town hall. Assemblyman Abinanti.
You want me to go first? Okay, fine. I'm Tom Abinanti. Hello to everyone. Thank you for letting me join you. I am an assemblyman from Westchester County. I am the chair of a relatively new committee on people with disabilities. I am the father of a 22-year-old young man who has autism. He was fortunate to be able to go through a very good program at Pleasantville High School. But still has his disabilities. He's nonverbal. And we are now looking to prepare for his future. He is in several day programs. Unfortunately, they are not as active as they should be because of the pandemic. So we are, like so many of you out there, are dealing with the results of the pandemic. I have attempted to meet with people all around the state to put together an agenda. The commissioner will soon see my budget letter, which I gave to the speaker yesterday, which is single-spaced 9 pages long, with some of the things that I suggested that we should be doing to make things better. I want to take advantage of the new approach that we're hearing from the executive branch. The governor has come in and said there's going to be a distinct different approach, a new approach. She gave us a budget that touches all of the right bases. Problem is she's not putting enough money into each one of those categories, but that's something we can talk about. She's indicated an openness. She appointed a commissioner with whom I've met a couple of times already. So we appreciate the new approach. And I'm here to hear your questions and try to respond. But the one message I want to send to people, which I'll repeat later also, is educate yourself on the issues, motivate your friends and educate them to speak out. We've got to make it clear that there are people in this state who have not been getting the help and the support that they need. And now's the time to provide those supports.
Thank you, Assemblyman. You couldn't have said it better, and you couldn't be more among friends and colleagues and peers. As you know, Families Together represents families and young people with multiple system involvement, including developmental disabilities. And many of us as staff are parents or young people themselves with lived experience. And as you said, Commissioner Carrie Neifeld is new to this position and has hit the ground running. So Commissioner, would you like to introduce yourself?
Sure, that'd be great. Thanks so much for having me. I'm Carrie Neisfeld. As Paige said, I'm the acting commissioner here at OPWDD. It's been, I guess, about 99-ish days or so since I took over the role here, and I'm very excited to be here. Paige and I had the opportunity to work together when I was in the chamber, as she said, focusing on multiple systems that I was working with, and I've always really appreciated the work that Families Together does, because I think, as the Assemblyman said, it's so important to educate yourself about the systems that you're interacting with. And it can be very difficult, right? I'm a person who has worked in these systems most of my, career, and they're still complicated. And certainly when the systems cross over and interact with each other, it can be even more complicated. So I think it's really important that there's organizations like Families Together that help to sort of, share the brain trust, right, of information and how to navigate. I do hope, and I think under Governor Hochul, we're getting to a place where our systems are more accessible, where they're easier to access, where the processes are more streamlined. And hopefully we'll take less assistance to navigate, but I think we'll always need the assistance of people who've gone before us. So I think that's what's so incredible about this organization, and I'm really, really happy to be here. Since I started here at OPWDD, I've been trying to make the rounds and talk to everybody that I can, family members, people who access our services, self-advocates, certainly our providers. To me, the most important thing that I can do in this role is truly understand the system on the ground, the way that it works for the people that we're serving. Because sometimes there's a disconnect between what we're trying to do with policy and what we think we're doing, here in Albany, and what's actually happening on the ground. And I want to understand that on the ground experience, which to me is the most important. Like I said, we have an incredible governor right now who has really shown her true commitment, not just to individuals with developmental disabilities, but across the multiple sectors that you all represent and interact with. And I'm really hopeful. And, our partners in the legislature, Senator Mannion, Assemblyman Abinanti, we couldn't be luckier to have, true advocates working on these issues. And I'm happy to be joining the ranks, and happy to be here today to talk and to answer any questions that you might have.
Thank you, Commissioner. And, we're going to jump right into the questions because, as you both have said, that's what you're here to do, is to listen and to have a dialogue with family members and young people. So it's my pleasure to introduce Kim Kaiser, who is our Director of DEI at Families Together New York State. Kim?
Thanks, Paige. And again, I want to extend a warm welcome to both the Assemblyman and the Commissioner. We're happy to have you here. I'm really pleased about some of the things that I've heard you say thus far. So I know this is going to be a very productive town hall, because the issues that are facing our communities do really speak to equity and equitable access. We know that not all families have the same outcomes, but the majority of the families sometimes have very poor outcomes, particularly when it comes to transition, co-occurring disorders, and everything that has to do with the social determinants of health, or even worse, when you are dealing with a disability as well. So we have people here on this panel who I'm very proud of. I consider them allies. These are individuals with lived experience. So I want to move forward and proceed. And I want to start with Maria Garrett. Maria, you want to introduce yourself and let us know and ask your question.
Thank you very much. And thank you so much for this time and your attention. My name is Maria Garrett, and I am a parent, a care manager, and a family advocate, a peer advocate. I am in the Western New York area, specifically in the Buffalo area. And my question is, the journeys for families and individuals is very difficult, but it could be better informed with the assistance of youth and families who have living experience, who have been there. What is New York State doing to implement lived experience, such as the peer support services for families and youth with disability?
I think that's a great question. Would you like me to go, Assemblyman?
Sure.
So like I said, I'm relatively new here, right? 3 months, but my experience in the governor's office, gave me the opportunity to work with some of the other systems on the behavioral health side, particularly OMH and OASIS, where, the use of peer supports is really active, right? And, becoming more and more active every year. So it's certainly something that I have brought into my conversations here with the team at OPW, is how can we incentivize families as peers and individuals. I hear anecdotally a lot about individuals with developmental disabilities going into the career of a DSP, which I think is wonderful. But that's just anecdotal information, right? I want to understand better when that happens. And I do think that, one of the things that's really important is for us to research, how peer support services can be carried through into our waiver for our supports, because I know that they're active in the waivers for the other systems. So it's on the top of my mind. I'm glad you asked the question. I think it's really important.
Thank you so much. Thank you.
My response to this is I think we have to concentrate more on involving families and clients in decision-making and in bringing them together. Let me suggest, number one, we should start at the school level. Many of these young people have gone to school together. We've got to encourage them to keep that group together because they know each other. They've worked together in school. They've lived together. They've done some activities together. We've got to find a way for them to continue those relationships. One of the things that I've seen here in Pleasantville, where I live, is there's a young man who's a self-advocate, has put together an organized group. They meet every month on Zoom. I've already spoken to them. And that's a perfect example of what I'm talking about. It's self-advocates getting together and bringing others in. So I think we have to talk about formalizing these processes. And if OPWDD or other groups can be of assistance in getting these things going, I think we should be doing that. Secondly, I think we have to reorganize our day have programs. The day have programs have become babysitting services. They should be socialization centers. They should be places where the people on the ground are encouraging socialization among the people who attend them. We do have different agencies out there doing bowling, doing horseback riding, doing this, that, and the other thing. But we've got to find a way to keep the connections among the individual clients. Because when they go from place to place to place, yes, it's good that they get a broad spectrum of people that they're with, but they're also feeling isolated because they get pushed in here, they get pushed in there, but they really don't have any companionship. They don't have this. So I think we've got to find a way to have day have as give this to them as one of their functions. And lastly, I think we have to encourage individuals to choose their own living space. They need to not be put in a group home over here where there's an empty bed, but live together with other people that they're comfortable with. Now, that's very difficult to do. That's expensive to do. But I think that's part of what we're talking about here. You want them to have people they're comfortable with, who they can confide in, who they can work with, et cetera. So I think there's a lot of things that we can do. It takes a little bit of a change in attitude. But I think what you're talking about is very, very important. I could see it with my own son. I hate to keep going back to the individual circumstances, but my wife has been very good at getting together a peer group, and they do things together. And I think that's really very important. You know, these kids went to school together, some of them a little older than the others. They go to different day have programs, but they get together. They will go out to dinner together. They will do things together. And that takes effort. But I think that's really very important. So thank you for the question.
Thank you so much. Thank you.
Thank you.
Can
That
I
was
share just a little bit of additional information?
go ahead. I'm sorry. Go
To
ahead.
touch on the points that the Assemblyman brought up. So on the point about day programs, I think we agree at OPWDD completely. You know, I think the pandemic, you know, shined a really bright light, right, on the ways in which our congregate day programs were just not working for the people that we served, and completely failed us, right, and during the pandemic when people couldn't be necessarily congregating. So we're doing a few things with our day programming that I think is really important and exciting. You know, we've been the beneficiary of a large amount of funds from the American Rescue Plan Act. And so a large portion of those dollars are going directly into the workforce, which I know we'll talk about later. But for the remainder of those funds, approximately $200 million, we're issuing grant opportunities seeking innovation. And one of the big areas that we're seeking innovation is in day programming, helping to understand how providers can, if they want to, divest from some of the property expenses, right? Because a lot of, a lot of providers have invested in congregate spaces, and, having an opportunity to divest from some of that if they want to do, without walls programs, or focus more on community-based opportunities, certainly employment. So we're very supportive of that and seeking, seeking ways that providers are using innovation to better serve and better, engage individuals in the community. And then through the state of the state, the governor has proposed two pieces that are specific to workforce, but will have, an impact on our day programming overall. We'll be looking at our certification process for day programming so that we can make it easier for providers to serve people with the full continuum of day programming. So it's not just, individuals won't have to artificially choose. Do I want to do a congregate program? Do I want to do it without walls? Do I want to do employment? With the way that we'll be restructuring our certification process, providers will be incentivized to have all of those opportunities available. So an individual doesn't have to make that artificial choice, and then can instead, choose on, maybe 3 days a week they want to, do employment program. 2 days a week they want to be in the community, 1 day a week they want to be, you know, in a congregate setting socializing. So we're trying to make it easier for individuals to have that person-centered approach to their day programming and be able to choose what makes sense for them. And then in terms of residential, we're doing a lot, you know, when it comes to, you know, strengthening, again, that continuum of residential supports, you know, looking at, you know, the more, you know, integrated and independent settings in the community, independent living, supportive housing, all the way up to, you know, certified residential and everything in between. And we'll be, you know, soon, you know, providing opportunities for providers and groups of families to come to us with ideas for how they might, you know, how they might develop certain housing programs. I know there's a lot of interest in, you know, being innovative and sort of out of the box when it comes to residential and housing supports. And we'll be putting forward opportunities for providers and families to bring us those ideas so that we can, you know, work together to help them become reality.
Mhm. Yes. Yes, just following this, and thank you so much for all this exciting news. And I just want to build up a little bit of what the Assemblyman said. It's so important to include families and peer advocates. I'm a care manager, and I have some co-workers that do not have the experience of being a peer, living the experience of being a parent or a peer. And this wealth that peers bring is so important. And if they could be included in a waiver service, that would help everybody so immensely. And thank you so much for your attention and
Completely
for
agree.
caring.
Completely agreed, Maria. And that's why you are a fierce advocate. And yeah, it's very important. And I also want to add that whole transitional, the vocational have, the individuals that work with families, that social component and that lived experience component should be interwoven into every single deliverable, because having that connection it empowers. We want people to take charge of their own destinies, because that's what self-direction is all about. But you know, that has to start from the ground level. Thank you so much, Maria. And I'm going to move on to a very, very wonderful advocate with a very beautiful name, Mabel Batu Tiaco. Mabel?
Hello, my name is Mabel Batu Tiaco. I'm a self-advocate from Plattsburgh, New York. I am an individual who is in need of services through OPWDD. There are long waiting lists just for evaluations and actual services. I've been on a waiting list for over 2 years. My question is, what will New York State do to help individuals who clearly qualify for services but have to wait for a very long time?
You want me or you want to go first?
Go ahead, Assemblyman.
You want me to go first? Okay. This is a situation where, what I said in the beginning, the governor seems to have recognized the problem, but I think we have to do more. And this is where we come in. We have to show the governor where we need to do more. First of all, a lot of this comes down to money, okay? The staff at OPWDD, I'm going to say, has been decimated, okay? The numbers of people are down from many years ago, but more importantly, we've given them more to do. And so we have this new system that was put in place of the front door. As I understand it, OPWDD employees are now expected to not just approve things, they've got to do them in the first place. The old system of having the agencies and others prepare the paperwork and advocate, I think should be revisited. Maybe we need to have a combination system of OPWDD staff and some of the agencies, because I believe that our OPWDD employees are asked to do too much. And therefore, it takes longer to do it. I mean, you've got to have staff now that help prepare it. I mean, I went through the whole process once, and I got to tell you, it took forever. And it took me half the time of everybody else. Again, because I have a wife who's a broker. She understands this, you know, and I'm a lawyer, an assembly member. So, you know, we were all working together. But I saw the burden placed on OPWDD staff. And I think that we really should use some of the old system, a combined system, to allow the outside agencies and whoever do some paperwork here and help move it along. And I think that would relieve the burden on OPWDD staff. Secondly, I think that we need to have, we've got to streamline the process. The agency OPWDD over the years seems to have added more levels of approvals and reviews, et cetera. I don't see people with disabilities and their families trying to game the system. It's almost like they don't trust the families and the people. You know, I really think that what we're trying to do here is deliver services. And for the small amount of fraud that you're going to have out there, which I think is going to be minuscule in this area. There may be other areas where people are trying to get things they're not entitled to. But in this area, I don't see that happening. So I think we need to have less of reviews, less levels of reviews, and have more people looking to deliver services. Thirdly, I think we need to have a big effort to get more of a workforce. Again, the governor has put some real money into the budget. When the commissioner sees my budget letter, she will fall off of her chair, because I've asked to double and triple the amounts that the governor has put in. We really need, you know, when the governor talks about a bonus of up to $3,000, which was great, my answer is it should not be the ceiling, it should be the floor. Because we have employees who are working at $14.75 an hour, $15 an hour. They can go down the street to Amazon or to McDonald's and make $20 an hour without all the grief and the pressure and whatever else they, you know, our employees are great in the private agencies and in the state, but there's a lot of pressure on them and they're not getting paid. These are not minimum wage jobs. These are much, they're not minimum jobs. They need a living wage. And so we really need to pour a lot more money in. And that's, look, it's expensive. There's no question about it. We're going to have to figure out where do we get these monies on a permanent basis, not just on a one shot. And then we also have to increase the pool of people willing to do these jobs. And we've got to start with, there's ideas all out there all over the place. You know, we've got to start in high school to entice people into this field. We've got to have Boces programs where there's training. We need community colleges that have courses in how to be, and it's not just the first level. There's a shortage of workers all the way up the line in every one of our agencies. We need to look at how do we increase I think we've got to find a way to deal with new immigrants and somehow protect them while they work in the human services field. We've got to ask the federal government for some waivers, for some protections for immigrants. We've got to find different ways to increase the pool. And look, even our state entities are having problems. There are 100 group homes have been closed. They say suspended, but that's 100 places, upstate New York, that doesn't have the staff. I go along with the union proposal. Let's revisit Tier 6. I thought it was a bad idea when we did it in the first place, but that's the only, Tier 6 is the retirement plan. And what they're saying is, even though they're offering union wages and giving union protections to employees, they still can't keep the employees because there's no long-term benefit to being there, because the Tier 6 program is just not sweet enough. So if that's what we have to do, then I think we have to look at that. But there's a whole range of things. So the commissioner has a lot to look at, because this is a major problem that's dumped in her lap as she walks in the door. So when we're not willing to sit around while, you know, she does studies and stuff. She understands we've got to move something real quick here. So I put in some suggestions. You know, we've got to work with her and give her some support so that those people making up the budget recognize that the OPWDD needs a lot more money.
Thank you.
Commissioner, I gave you difficult.
We certainly would not deny any additional money that the legislature sees fit to put in the enacted budget, that's for sure. And I could not agree more that our direct support professionals and all the folks who work both within state operations and at our provider agencies, really, you know, they're doing a hero's work. And, you know, I think everybody knows I started my career as a social worker, and the jobs are demanding emotionally and physically. They take a lot out of you, but what they give back to you also is so incredible, right? There's no greater reward than, being able to support an individual as they're, reaching their goals, and living out, what they want to do with their life. And it's a really very rewarding career path for those who choose it. So I guess that what I would say is a few things. You know, the governor or the Assemblyman had a lot of great ideas, and you know, happy to say that there are ideas that, you know, many of those ideas are ones that we announced in the state of the state. So we have partnerships with Boces. We have a very successful partnership with Boces here in the Capital Region that we're scaling statewide over the course of the next year to do exactly that. I think a lot of people who are entering at the DSP level are entering right out of high school or right out of their associate's degree. And so these Boces programs provide over the course of an individual's career in Boces while they're studying and you know, attending Boces, also, you know, the opportunity to do training classes specific to becoming a DSP, on-the-job training, being able to shadow existing DSPs, you know, to really get the understanding of what the job is and to be prepared to enter right after graduation. So we're really excited about that. Partnerships with Suny and Cuny, you know, we have two currently, one in Westchester County, and one in the Bronx. We'll be scaling those partnerships statewide across the state so that there is specific coursework at the SUNY for all, the EOCs, you know, that's targeted directly to DSPs. So it will be, it's twofold, right? For the DSP, that's a double benefit, right? It gives them the opportunity to earn college credit, and it's giving them coursework and training that's specific and germane to their job. The other thing that we're doing is working with Suny and Cuny to have to allow a certain number of hours that an employee works as a DSP to count towards college credit. You know, Suny does a great job at using lived experiences to count towards college credit, and we're going to work with them to make sure that that is applicable for our DSPs as well. We have great partnerships with the Department of Veteran Services and with the Office of New Americans to recruit, you know, individuals who are looking for work, you know, individuals who returned, you know, from active duty or, you know, retired from the military. And through the GI Bill, we can actually provide them with a stipend while they're completing their training. So they're able to get a stipend, complete their training as a DSP, and then enter right into a career path. And the same with the Office of New Americans, which is, you know, part of the Department of State, working with them to connect individuals who are coming to America for the first time to this work as DSP. I mean, from our perspective, right, for the right person, you know, when they get involved in this career, right, it gets you, right? You know, people fall in love with the job, they fall in love with the families, they fall in love with the people that they support. It's just a matter of, I think, you know, dispelling that myth that this is adult babysitting, because it's not, right? It's so much more than that. And I think that, you know, people often think of, you know, people sitting around in scrubs on a couch playing on their phone, you know, and that's not at all what this job is, right? And so one of the other things that we're doing with some of our federal funds is working on creating and launching a real marketing campaign with PSAs and billboards and things like that to really try to show the true face of being a DSP, both from the perspective of a DSP and from the perspective of people who are supported by DSPs. Because from my perspective, you know, if that's an option for you as a career, it's wonderful. And you can really enter at a DSP level and work your way up and build a really great career path for yourself. And that's another thing that we're working on with the Department of Labor here internally, is on creating career paths for people so that they can enter at the ground and work their way up through an organization, and also working on credentialing so that individuals, you know, who are so motivated can take extra coursework, earn that credential. That credential says something, it means something, it can earn them, you know, an extra wage enhancement. We also have some partnerships with the Department of Labor to do apprenticeship, which I think is a really valuable program. You know, for me, when I was starting out in direct care, there's a lot of decisions you're asked to make and a lot of ways in which you're responsible for another person's life, and not having a mentor or somebody to help guide you through that, you know, that can make or break an individual staying in that job. You know, having someone to help guide them can be the difference that keeps somebody engaged in this career. And then, of course, you know, wages. I mean, I would be remiss if I ended this and didn't talk about, you know, the salary and what we pay individuals. You know, so, you know, the Assemblyman's right, between our ARPA funds, you know, which is $1.5 billion that we are investing directly into our workforce. That's through the form of 4 one-time bonuses for individuals who were working throughout the pandemic and are still working. And then through the governor's proposed budget, with the up to $3,000 bonuses, plus the COLA that is a 5.4% cost of living adjustment on our contracts. We expect a large portion of that also to go to our direct support professionals. And like I said, if the legislature, through the negotiations with the executive and the division of the budget, has extra dollars that they want to, you know, allocate in this way, we are happy to spend that on our DSPs and on the work that they do. So, I think getting back to the original question, right? The workforce challenges, a lot of that is what's causing these delays in the ability to access services because there are just not as many people to do the work and there are more people to serve. I would say too that since the governor took office, she has eliminated the hiring freeze waiver for state agencies. So previously, the state agencies were forced to do the same activities with less bodies, right? If somebody left, if they retired or they quit, state agencies weren't necessarily allowed to replace that person. So they slowly over time, that had a pretty, erosing effect on our ability to do work. And since Governor Hochul took office, we've been able to really begin to replace the ranks of staff here in the agency who are doing that important work, like front door work, self-direction, budget approval, things like that have been slowed down over the years. So we're hoping that will also make a big difference in people's ability to access services more quickly.
I think you're hearing that we have a commissioner who's paying attention. That's very helpful.
And that's very good. That's really
she's starting
good.
off in the right direction. I'd just like to add a couple of more things. I have a bill that I would ask, I don't know if they could do it administratively, but I would like to see a path. Not just, I appreciate the discussion about giving more pay for credentials. I'd like to see a whole system of credentialing going up the line so that you can eliminate I think there's a high school diploma requirement in many cases. We could eliminate that at the first step and then help people get a high school diploma and get more money the next year when they get that diploma, et cetera, et cetera. If we have a path up the line, again, that's going to take a little time to develop. The other thing is I think we've got to look at international internships. Looking back, I mean, that's a whole other group of people coming in from other countries to work temporarily here. The other thing is, some of the things are outside of the control of OPWDD that we've got to look at. There's a program, for example, to give tuition loan forgivenesses for nurses. I don't think it applies to OPWDD and OMH. And we've got to look at, at why does that not apply? Why does that not allow, loan forgiveness for those nurses who work in this field? We've got to look at an awful lot of stuff. Now, that doesn't go directly to the DSP, but our agencies in our state need to have medical personnel back up as well. And so there's a whole series that we've got to really take a look at the entire field of what we're doing out there. One of the other simple things, and I commend it to the commissioner, I know they've started to do this already, is to take a look at the workload versus the staff resources. For example, the Taconic region has been backed up much more than other parts of the state. And, so I can't explain why. I don't know if we put more applications in or whatever on self-direction. But, take a look and see, do you need a roving team that would go from region to region to region to help with backlog? I know that they've already taken a look at some of this and they've started to make some changes. I commend them for that. I just urge them to keep going in that area. That goes directly to the point of backups and why it takes so long, et cetera.
Thank you, Assemblyman. And, I just have to say, I love everything you're saying here. So, because I love everything you're saying here. And I also want to add that, we've talked about a lot of very solid systemic solutions here. But I also want to, before I pass it on to the next speaker, I want to just add that, when you're talking about somebody like Mabel, I really think it also does help when you're able to have, you can have a gatekeeper, a care manager to oversee, but this also speaks to training. We need to learn how to teach people how to fish, how to build their own social support system. In the meantime, we have to look towards more grassroots, not contracted, not connected with, but the things that are important to the individual. That's true self-direction, and that's true looking into what are the lenses, what are the passions of the individual. Those things can be fed while we're waiting for the systemic solutions. So along with that, if we can also look a little bit below that systemic lens also, I think that would really help to strengthen the system. You all have a lot on your plate, Commissioner, you have a lot on your plate, but that can all be strengthened with things that are not traditionally within your purview.
I think it's a great point, and yeah. we are looking at how we can do advocacy and self-advocacy training for the individuals that we support, because we think it's really important. We employ some self-advocates here, but we're looking at how we can make those self-advocates who are employed by the agency, play bigger and stronger roles in what we're doing. And I think that bringing on the next generation of self-advocates and teaching people how they can advocate for themselves is really important. And I think that's tough for everybody, right? I mean, even when I'm at the doctor sometimes and my doctor tells me the thing that they're going to do, right? Or this is the answer. And I feel insecure sometimes to fight back against my doctor, right? But this is my healthcare. I need to take control of that, right? And we need to help, put that power into the hands of the people that we're serving as well. I believe that very strongly.
Yeah, the goal is we don't want people to need. We don't want you to need us. You work yourself out of a job, then you're successful. So on that note, I want to introduce Simca Weinstein, and he has a question as well. Simca.
Thank you, Kim. Commissioner, Assemblyman, you are both awesome, and I thank you for this opportunity. My name is Simca Weinstein. I'm a parent, a dadvocate, and a DEIA coordinator at Families Together. So my question is that our 16-year-old autistic son, Ellie, is currently attending a residential school, which I credit with nothing short of saving his life. He's also becoming a real mensch. Ellie will graduate at 21 and will likely move into a group home. Parents like me spend years worrying over what will happen to their children when we're gone. Where will they live, and how will any crisis that arises be addressed? So I would like to know, as leaders of New York State, I'd like to ask firstly the admissions process and crisis response process, as well as policy and planning, and are these factors informed by people with lived experience? Thank you for your consideration.
A great question. You want to take it, Assemblyman, or you want me to start?
Okay, I can start or either way. It might be better. Want me to go first?
Go ahead.
Okay. First of all, Simca, the original question, I thought your son was out of state.
Yes, he's currently in a residential school out of state. He's in Boston. He's in a school in Boston. However, he's going to be in a group home. Okay. First of all, I worry what that process looks like, and to what extent that our family will have a role in that process. Okay, I'm going to advocate for a few positions and let the commissioner talk about the present system. I think, first of all, there needs to be a closer relationship between the people who produce the IEP and OPWDD. There's a proposal by the OPWDD to institute something called the CANS system. They clearly understand the problem, and this was their proposed solution, which is to try to get OPWDD to get more information about young people under 21 and not just wait until they're 21, so they're talking about doing this system. I want to propose to them, and this is the first time the commissioner will hear this, that we use the IEP system instead and buttress that system and have the have OPWDD work with the people who already know the kids, who are doing their evaluation now. And I think we could save money that way and have a better report back as to what the young people need. So I think, first of all, there's got to be a better connection between the schools, and so that you can have a real transition. It's not just you just come to the end and you move. Secondly, I think that's got to be part, that exit plan should include the residential needs of that person. I know you have an exit plan today, but I don't think it goes that far. It talks just about the next step. So I think now that the schools are going to push back on this, but I think we have to get a closer relationship here, because we've got to have life planning from the beginning going forward. Secondly, I think there has to be a due process procedure for those who are out of state. Several years ago, I was involved with one of the other assembly members. We passed some legislation to require due process for families of young people who the OPWDD wanted to bring back in state. And earlier, before the commissioner became commissioner, OPWDD tried to do an end run around that process. So I have some legislation right now to close a loophole.
But I think it goes to exactly what you're talking about. There needs to be more cooperation between the families of those who are out of state and those and OPWDD. I don't believe that I believe that the families, like you say here, of those who are out of state want to bring them back in state. They really don't want to leave them out of state, but the only reason they're staying out of state is because we do not have the facilities here for complex needs. So that brings to the next point. Some of the agencies have said that if OPWDD would set up a new process and go and they would try to do some pilot programs for young people with complex needs. It's very expensive, and you need certain skills. You need a whole plan, but they are willing to sit and work with the new commissioner to try to develop a program so that everybody can come back into state. Once we start doing that, then we have to go to SED, State Education Department, and talk about how do we set up schools that can deal with these young people with these complex needs, so we don't have to send them out of state. And we seem to be going the wrong direction there. We have special act schools. We have other programs that seem to be get cut back rather than expanded. And so that leaves even less places, the fewer places for people with complex needs to go in our state. But I think one is the IEP process and more connection. Two is this due process, which forces OPWDD and the parents to get together. And three is, I think we've got to start to set up an in-state program. I know the commissioner is going to tell you they've been doing some things. They're talking about changing the formulas to meet acute needs, which is a step in the right direction, but it doesn't go far enough. It really needs to, we've really got to have a whole program here, a program where you can stabilize an individual, and maybe even if they're not, maybe not even keep them in the complex needs program, maybe eventually transition them to a regular group home or some other environment. But there's a lot to discuss there. And, once again, the commissioner's coming in and we're dumping this problem in her lap, trying to give her suggestions, and she seems open to them. So I'll give her a chance to talk.
Sure. I think, there's a lot there in this situation to sort of unpack. So I guess I would start by saying, I'm very committed to doing what we need to do as a system to keeping kids, in their homes, in their communities, certainly in New York State. We, OPWDD, we undertook over the summer, right, a very in-depth, robust strategic planning process. And one of the things that came out loud and clear from our strategic planning process as we engaged stakeholders was the need to better serve children and to better serve individuals with complex needs. So I would say that, we are working closely with SED to try to have better coordination at the local level. As you know, right, it can be very complicated with the number of school districts there are across the state to try to bring some kind of consistent practice to the way that OPWDD is involved in planning for kids who are before the Committee on Special Education. But we're working very hard to make sure that OPWDD is represented there, because we believe that if we're represented there early, right, we're able to help support the family, right? Sometimes what happens is that during the school hours, right, the school has the right supports in place, and during school hours, the student is really well supported and does great during school, but it's the before school hours, it's the after school hours, it's the weekend, it's the holidays, it's the vacation. That can be challenging for families if they're not supported well by our system. So we're working very closely to try to get more involved at an earlier stage, because oftentimes these children aren't known to us yet, right? They're known to the school education system, they're not known to us. We want to get involved at that early stage so that we can wrap those supports around a family. And we believe that if we can do that, we can prevent some of the need for residential schools to begin with. In the instances where we can't, right, because it won't be every instance that we'll be able to prevent that, we want to work with our providers. We want to work, with obviously the legislature to make sure that we have programs in state that can support the needs of the students. So certainly, if there are providers who are looking to meet that need, we're happy to work with them to understand what they're proposing and to try to work on that. When we're talking about students who are graduating from an out-of-state school and wanting to come back in, it can be a challenge sometimes, because the out-of-state schools are providing something that we weren't able to provide in New York. That's why they ended up there to begin with. And sometimes our adult system can meet those needs and sometimes they can't. The Assemblyman referenced that we are updating our rate making methodology currently, and hopefully we'll be rolling that out over the summer so that we are no longer looking at the past costs of a provider. Currently, we basically pay the historical cost to a provider. That's how we assess and make our rate. So what we're doing is looking to switch to a acuity-based methodology. So we'll be paying a provider based on the needs of the individual that they're serving, which will incentivize providers to be able to serve some of those higher needs individuals. They'll be compensated in a way that will allow them to staff appropriately, hire the right specialists, whatever it is that they need to support that individual. The Assemblyman mentioned, using the IEP as a tool. I guess I would say that the IEP is absolutely informative to understanding the needs of the individual, but the IEP is really focused on the challenges that an individual is experiencing academically, right? And it's focused on how to ensure their success while they're in the school. I think the CANS, the Child and Adolescent Needs Assessment Tool, is one that's used across multiple systems, and it's an evidence-based practice. It's designed, to understand, behavioral, psychosocial, medical needs of an individual, of a child, of an adolescent, right, which are very different, obviously, than that of an adult. So I don't think that the IEP can really replace the CANS. I think those two can both, provide a lot of information and certainly a much more robust information about who that student is, so that we can make those rates. We are very excited about the CANS. It's the companion to the adult tool that we're using, which is the CAS, also another evidence-based practice that is used across multiple systems and really does, seek to get a detailed understanding of the individual. We've been working on those over the course of the last 5 years, and have been really, working to perfect them. So the rollout over the last several years, when families were engaged earlier on in the process, some of them weren't as thrilled with the tool, but I think as time has gone on, we've been able to show that tool really is valuable. So, and then finally on I think the last piece of your question, and please let me know if I missed anything because it's important that you have this information. Families absolutely are part of the process for choosing the adult, opportunity when your son does re-enter New York State. You'll work through your care manager here in New York to access residential supports. We have a CRO process, a Certified Residential Opportunity process, where we'll get to understand through our assessments the needs of your son, and we'll work with providers to meet those needs. You guys will have an opportunity to meet with those providers, see those residences, get to know who may or may not be your son's, housemates, and then you all make a choice, and the providers make a choice as to whether or not this is a good match. And we continue to work with you until that match is found. Currently, we're having the staffing issues, which are making it very difficult for us to, find opportunities for people because there are just not enough staff to support those needs. It sounds like your son's got a few years before he comes back, and I'm confident that we will have worked out some of these challenges before he returns.
So, thank you, Commissioner.
I just make one more comment. I think you guys.
One more comment because we're out of time. We got more questions.
Okay. So. You finally found a disagreement between me and the commissioner.
No, it's perfectly understandable. And I hate to part ways.
Well, let me just make the point that I think that people are not happy with the CAS either. And I remember my son, when he was young, went through something called Vineland or something like that, which was to measure life skills and social and adaptive behavior skills, et cetera. And so I think that we could, in fact, use the schools for this purpose. But we're going to have some conversations because I'm understanding from people they don't like the CAS system either.
I'm gonna throw a cog in this discussion right now because I'm going to tell you right now, nothing is an absolute unless the systems are willing to be fluid and flexible and understand what you crafted 10 years ago is not necessarily going to work now. It's not going to work with every ethnicity, every gender, every culture. So just be open and be fluid. The more information you have, whether it's school, CANS, or whatever, the more it's going to inform the process. On that note, I want to move over to the last question.
Okay.
And that is from Ms. Angelique LaSalle. And Angelique has a question that is near and dear to my heart. Angelique.
Hi, everybody. Thank you so much for the opportunity to be here. I am privileged to be a part. I'm a parent of 3 boys. Specifically, I'm talking today about my 10-year-old son, Riley. This is him, so we can put a face to the name. He's 10 years old. He has autism. I'm a parent that lives in Westchester County. Riley has no support to address his need for social skill development. For him specifically, this has led to mental health issues due to social isolation and lack of positive interactions with his peers. This occurrence of mental health struggles in communities with autism are extremely high, especially now during the pandemic. In addition, people on the spectrum are 10 times more likely to complete suicide. What can New York State do to infuse funding into programs for social groups, social skill building supports, and youth peer supports for individuals with disabilities who have low support needs? And like the commissioner said, I am responsible for a person's life and happiness. If I don't have these resources or a path, like you say, where do I go? What do I do with my son when he's feeling sad? And there's no place for him to go to talk about this. He's Black, he's a child, he's very high on the spectrum. He's wondering about his sexuality because it's very overt nowadays. There needs to be a forum and a place for him to address those things as well. So thank you.
Commissioner, you want to go first?
Sure. Thank you so much for sharing your story, and thanks for sharing so openly about your son's experience. He's very cute too. Thanks for sharing his picture. I understand, you know, the need for, you know, these opportunities, especially social opportunities, especially for people on the spectrum, which can be, right, the most difficult part of overcoming that aspect of their disability is the social connections to other people. And it's not that people don't want those social connections, right? It just looks and feels differently for them. And so that isolation, although maybe we don't think that they're feeling isolated, they really are, right? So I think it's really important. We're doing a few things that I think are really important, you know, in our work with OMH, right? Because there are a lot of individuals who have SMI, serious mental illness, and, you know, developmental disabilities, or vice versa, have developmental disabilities, and then either, you know, because of isolation, you know, develop depression, or just have co-occurring, you know, serious mental illness. So, you know, Dr. Sullivan at OMH and her team are very committed. You know, we here at OPWDD are really committed. We're working specifically on ways that we can together serve individuals, you know, young people and adults as they're experiencing these different but intertwined, you know, experiences and crises, right? That can sometimes become crises. Certainly we're working with OMH. They have a mobile crisis unit for whenever there is a behavioral health crisis. We're working with OMH to make sure that the people who are trained to as mobile crisis interveners have the ability to reach out to the OPWDD system for technical assistance, so that they, you know, they have the ability to get trained, right, on how to sometimes interact with people who have developmental disabilities, because it can look very different, right? And I think we see, right, instances where, you know, crisis supports come, or God forbid, police get called, and, you know, people don't know how to respond to some of these challenges, right? So we're working really hard to make sure that the OMH system gets from us what it needs to be able to support people who are dually diagnosed. We're working with OMH as they stand up the new 988, you know, crisis line, which would be you know, an alternative for 911 if somebody's having an emotional or behavioral crisis, rather than calling 911, which is sometimes not necessarily the best system to respond. 988 will be there for some of these behavioral challenges, and we're working with that. Of course, we would, you know, don't want to only be addressing crises, right? We want to be, you know, trying to intervene much earlier than that so we can avoid crises. But when crisis strikes, we are trying to address, you know, in partnership with OMH. You know, I'm seeing a lot of, you know, social support venues crop up across the state for people on the spectrum, you know, with different types of ways to engage within those. I think some of the ways that we support that at OPW, certainly, you know, with a self-direction budget, individuals who are self-directing their services can apply for and pay for some of those services or some of those memberships at some of those social clubs. Our family support services across the state is also another avenue that you might check out to find access to some of these types of goods and services that can be helpful for social support. within your community. And obviously, things like, SANES, the Self-Advocate Society of New York State, that's another area where individuals who, identify as self-advocates come together, socialize, work together to advocate. So we can make sure that you get some information about these resources based on where you are. We can certainly connect you. Obviously I don't know the specifics of, where your son is going to school or what's happening there, but I can reach back out to Paige to get your contact information and make sure that we're sending you, sort of geographically specific information, on ways that you might connect. But certainly, I think it's a really important area, for us to be paying attention.
Thank you.
I would agree with the commissioner on everything she said so far. I just add a few other things that may not necessarily be within the OPWDD system. We do know that this problem that you're referring to is going to get worse rather than better. I'm understanding that half of the people who get services from OPWDD are under the age of 21. So you're dealing with a very large population, and they're going to get older, and as they get older, they're going to be moving into the OPWDD system. So we've got to strengthen the SED programs to deal with young people so that they're not very significantly, that they don't have great significant needs by the time they get into the OPWDD system. So how do we do that? Well, we've got to concentrate on the programs for kids with special needs in school. And I've proposed that the state pick up the cost, because right now it's a very significant burden for our school districts. But that's also going to be a burden for the state, but I think the state's in a better situation to do it. We also have legislation some of my colleagues have put in to require that there be a social worker or a behavioral specialist or a psychologist at every school, or at least in every school district in the state. And I think that's really important. Part of the problem is we do not have enough people who understand autism and other developmental disabilities. I mean, it's in Westchester County. I mean, we had to go to Stamford, Connecticut to get a psychiatrist for my son, so I sympathize with what you're saying. There are very few of them around who understand people with autism, and even fewer who take Medicaid. So if you're in the OPWDD system and you're trying to get, a psychiatrist or a psychologist, it is very hard to do. And that's a problem that we have to work on. I asked for the commissioner's help on this, but it's not her responsibility. This is a bigger problem, so she can be an advocate for it, and we really need her help on that. But it's not within the jurisdiction of OPWDD to solve this problem. It's within their understanding, within their expertise, but we've got to get others in the state to deal with this. The second piece is crisis response. The commissioner referred to that. We do not have a good crisis response system. Even in Westchester County, I know the county executive has reinstituted something we had when I was a county legislator many years ago, which is a crisis response team. It got abandoned. He's trying to put it back in place. It's only spotty. It only goes in certain places. And it really does not have, we have an excellent mental health commissioner in Westchester County. Michael Loth understands the problem. It's just a question of addressing it. How do you put together a crisis response team that's necessary? We have a lot of resources, and I would just put this out there. I don't know if OPWDD could help us organize this, but there are a huge number of places out there. Everything, we got the Anderson School. In Westchester County, we've got all of the different schools, the special act schools. We've got all kinds of entities out there, JCC. Is there a way that we could get their experts to volunteer some time to be on a crisis response team? I know personally of problems. I've had constituents call me. I've gotten them involved with the Westchester crisis response, but even there, it's very difficult. So the other thing is we've got to train first responders. We need to, because there's the first one to show up is probably going to be a police officer, and we've had bad situations, and some people in the community understand this. Some took advantage of Governor Cuomo's push for a better response by police, if you remember. I've been involved in some of the community discussions about what the police department should be doing. Again, it's expensive, but we've got to train police officers to recognize the difference between a criminal and somebody who's got a developmental disability or some other type of mental illness that needs a different type of response. How to quiet down the situation, secure the situation, and call for the backup of the proper teams. And that's particularly bad. Your son is 10. Once he starts to hit puberty, that's when you really have a problem. And
he's
so
already there, but he was also an advocate for policing and autism. He did do a talk. We need more of those.
Yes, exactly. So that's something that we really need to do. And then thirdly, the commissioner dealt with the issue of co-occurring conditions. That is a very difficult issue. It's people with but we don't have temporary beds. We don't have outpatient services to refer your son to. And that's, we used to have that years ago. Little by little, they have disappeared. And so it's, there's a famous story about a young man in the city who's in the mental health system, and he has autism. He should be in the OPWDD system, but he's never been there. And he's got certain complex needs, and there's just no place for him to go. So you're highlighting an issue that we really have to deal with. And lastly, we've got to find meaningful activities. And the schools are not really good at this. After school activities, if you're not playing football, if you're not on the basketball team, what are you doing? And particularly in the suburbs, I was on the debating team when I was in high school. That kept me out of trouble. But that's not, we really need to find ways, particularly these middle schoolers who are the ones who can get in trouble. And we've got to figure out a way to deal with that issue. So you're highlighting something that has many, many different aspects to this. And we've got to deal with it. We've got to deal with it.
There are many layers. Thank you so much. Thank you, Angelique. Thank you, Assemblyman. Thank you, Commissioner. Thank you to everybody here. I'm going to kick it over to Paige so we can close out. Thank you.
I just want to say we went way over our time, and that just demonstrates the commitment from both the Assembly member and the Commissioner. Thank you so much for listening, for responding, for being open-minded about opportunities. I would encourage you, Commissioner, when you're talking about working cross systems with OMH, to go beyond just serious persistent mental illness and developmental disabilities. It's not just about diagnoses, but rather about wellness. And I say this all the time to the Commissioner at OMH, that they're the Office of Mental Health, not the Office of Mental Illness. And so our young people who have a developmental disability need emotional wellness, mental health as a part of their healthy all around life. I just want to say again, thank you for your commitments and your empathy and your attention to the details that our speakers brought today to you. And as you can see, we're a very diverse organization, not only, racially and ethnicity and age and geographic diversity, but also we cross all of these different systems. And none of our children and none of our families fit into the silos that the state agencies and the legislative committees have. So we appreciate you recognizing our diversity, recognizing our multiple needs, and we look forward to working with you in the future. And thanks especially to all of the ambassadors who did the questions. You brought your personal stories and kept it real. And thank you so much. And we have this afternoon at 3 o'clock, a town hall on education with the Commissioner from the State Education Department and chairs in the Assembly and Senate. So thank you again, everyone.
Thank you for letting us join you today.
Thank you.
Thank
Bye,
you.
guys.